photos of ART procedure. This is the control ovarian hyperstimulation, which means we give a massive amount of hormone to get, in order to get more than one oocyte from a single menstrual period. This is in vitro fertilization, which means we co-culture cell oocyte and the sperm in vitro in order and let the sperm fertilize the embryo, fertilize the oocyte by itself. This is intracytoplasmic sperm injection. We use this procedure to mainly to treat those patients with low sperm count number. So we need only one sperm to fertilize one oocyte. We just pick the sperm that look healthy. This is PGD, which is pre-implantation genetic diagnosis. It's when the embryo has more than 6 eggs, has more than 6 cells. We suck 1 or 2 of them out and do a genetic screening and so that we only transfer healthy embryos into the uterus. These two are for researchers. Our study mainly focused on IVF and ICSI. They all go through control ovarian hyperstimulation, and you can see that this is a very violent procedure, at least for the cell. Because the ART procedure is an unnatural biological process, so there are studies says that there are increased risk in ART procedure, some for the mother and some for the newborn. Because the ART process is overlapped with the DNA reprogramming, meiosis, and the mitosis of early embryo, so it's logical to think that there is increased risk of epigenetic and genetic changes in ART newborns. And there are studies say that this is true. But there are also studies say that it's not true. So it's a controversial issue that if ART have influence on DNA stabilization and modification. And that's what we want to study about. To study DNA stability, we didn't use the structural gene because these reasons. The DNA mutation frequency of one single point is very low, and the DNA polymorphism. Various gene mutation status is compared to what I will later be talk about, which is a dynamic mutation. And the mutation cell natural selection also compared to that. Here's some common types of mutation. We focus on dynamic mutation. The reason I will talk about later. Dynamic mutation, in these mutations, the copy number alteration alters. The trinucleotide repeats alter through generation. In the normal population, like us, we all have a small amount of these repeats, and from generation to generation, it can change, but not much. It can increase or decrease. In the carrier population, they have more of these repeats. And from generation to generation, the variation is larger. Usually it's increase. For those affected, and we call them patients, they have more of these repeats, and they have clinical symptoms. There are 20 types of neurogenic disease associated with the dynamic mutations. This is one example of dynamic mutation, fragile X chromosome syndrome. We can see that in the normal population, people have 6 to 50 repeat in the non-coding region of 5' FMR1 gene. The expression of this gene is normal, and in the carrier group, people have more repeats, and but the expression is still normal. In the affected group, people have even more repeats, and because of that, this gene is downregulated. Here's another example. You can see in this family tree, it's a very famous disease, Huntington disease. You can see that the offsprings have you can see that those red ones are affected offsprings. They have expanded alleles, so it's an expandation mutation, more than their father, you can say. It means we can anticipate that they will have an earlier onset age, earlier than their father. We use the dynamic mutation genes to study the effect of ART procedure on DNA stability. It's because compared to what I just said, structural genes, these genes, it's they have a high mutation rate frequency. Which means if we use these genes to study the effect, we'll have a higher efficiency. And their mutation type is very simple. It's either increase or decrease the repeat count. And they are not under the natural selection pressure because the variation, if the variation is in normal range, it cannot affect the expression of the protein. We choose the 7 very common diseases. They are all caused by dynamic mutation genes. These 7 diseases caused by these 7 genes. And we collected blood samples from patients, and for the mother and the father, we collected their peripheral blood. For the newborns, we collected their umbilical blood, and we used PCR to amplify those 7 genes for each person, and then we used the page gel and DNA sequencing to study the mutation. Here's the primer sequence. So this is an example of contraction mutation. In this family, we can see about this gene. We can see that the daughter has. They are all homozygotes. They are all homozygotes, and the daughter has 2 5 repeat in both alleles, and one of them must from her father. The other one must from her mother. So from this, we know she has got a contraction mutation. Here is an example of expansion mutation. In this family, we can see that this son, this 10 must from his mother, and this 17 must from his father, and so we can be sure that he has expansion mutation. We first compared all the mutation of trinucleotide repeat regions, and they are all within normal ranges. And then we then compared the mutation frequency. This means the increase or the expansion or contraction rate, and there's no significant difference. And then we compared the frequency of mutation. So this is the mutation rate, and we found that there is significant difference between the ART group and the control group. But when we divide the ART group into IVF and ICSI, surprisingly, we found that in IVF group, it seems there is more harm than in the more mutation than the ICSI group. It is surprising because, as I illustrated earlier, ICSI is a more violent procedure than IVF, because everything an IVF patient go through, ICSI patient they all go through as well, like controlled ovarian hyperstimulation and in vitro culture of the embryo. Yeah, we couldn't explain this very well, but it is already published in the paper in the journal Human Reproduction. Yeah. And in the ICSI group, we can see we divided the patients based on if their infertility was caused by female factor or male factor or male and female factor. We can see that in the ICSI group, ART offsprings who come from a female infertility family had a higher mutation rates. And then because in ART group we found more mutations, then we studied the enzymes cells use to repair those mutations. We choose the 11 genes. They are all associated with DNA repairment. And we use, because we can't get the embryo from the patient, so we used their placenta to study. And first we used the RT-PCR to study the expression of these DNA repair genes, and found that most of the genes we studied have changed significantly. And 7 of them, especially 7 of them, are significantly changed. So we studied these 7 genes protein level and found 3 of them also significantly changed. And we also studied the methylation level of 5 DNA repair genes, and all the genes we studied, they had a lower methylation level in their promoter region. And we also used the mice model because we can't use the oocyte of human beings. So we used the mice model to get oocyte and find that 2 of those DNA repair genes changed in this oocyte. We think it may be caused by controlled ovarian hyperstimulation, because these oocytes only, compared to the control group, they only have one more difference. It's controlled ovarian hyperstimulation. So the conclusion we made were the frequency of dynamic mutation increased in ART offspring, and the changes of dynamic mutation frequency in ART offspring may be associated with the gene expressions and the DNA methylation levels of DNA repair enzymes. And COH may be associated with the change of the gene expressions and the DNA methylation levels of DNA repair enzymes. Okay, thank you. Okay.